Enter Migori District Hospital, and the first sight of the wards tells its own tale. In addition with contending with their illness, the patients also have to deal with the congestion.
Mahali pa kujisaidia kama kuogea, vyoo pia sio nyingi.
Hata nilipokuja hii maji ya kuongezwa nilinunua machupa kama 4 hivi.
Those IVs or drips are what the management of Thika District Hospital says is the best they can afford to keep seriously ill patients from dying. The process of treatment appears to be slow and painful for patients, yet when they eventually get prescriptions, they have to go out to buy the drugs from chemists outside the hospital. Here we found patients with severe burns sharing beds with other patients. Apparently, the hospital was built with a bed capacity of 265, and since then it has never been expanded, despite the increasing numbers of people visiting the facility. Despite the stature of a district hospital where patients hope to get all the medicine they need, the shelves in this hospital's pharmacy are empty. Hospital management says this is a serious problem that puts the lives of hundreds of patients on the balance. Drug shortage here, as in many other hospitals around the country, has been on for more than 6 months now, and patients are frustrated.
Sio haki kukosa dawa kwa hospitali, manake kila mwananchi anategemea serikali. Na kwa maana unaletwa hapa hospitali ya serikali, si lazima huduma zote upate kwa hospitali.
Medical Services Permanent Secretary Professor James Ole Kiapi says the ministry has had to stop other development activities in order to respond to acute drug shortages every so often.
If we take this approach of just firefighting forever, in another 5 years from now, we'll be talking of a different problem altogether. The health system can easily collapse in this country because the infrastructure is dilapidated, it's very weak, we need to build it.
At the Nyeri Provincial General Hospital, the situation is not any different. During his tour to hospitals in Migori, Kehancha and Isebania, Professor Kiapi witnessed just how badly the facilities have been overstretched.
All public hospitals are in dire need of being lifted to to being improved. Some of them are lacking theaters. Some of them have wards that were built for a population of 1,000, and now the catchment area has increased 10 times.
With 200 facilities at the level of sub-district, district, provincial and referral hospitals, the PS says at least 4 billion shillings is needed for their rehabilitation, expansion and purchase of equipment. That a healthy nation is a wealthy nation may be a cliché, but the situation in this hospital, which is a replica of many other hospitals around the country, where there's a glaring lack of essential medicines and basic facilities such as beds, is an indication that the government is far from achieving a healthy nation. Sylvia Chabet, Sunday Live.